Okay, so do you just want to introduce yourself really quick before we get started?
Sure. Hi, my name is Megan Cobb. I'm an assistant professor for the Department of Pediatrics at the University of Maryland School of Medicine. And I'm also a full-time emergency medicine attending in the pediatric emergency department.
Thank you for joining me today. So can we just kind of jump in and go over um, how common are hot car deaths and why do they continue to happen regardless of, if people are aware of them or not?
Sure. So, one of the things that we know about these deaths is that the numbers have steadily increased over the last 7 to 10 years. So, in 2018, 2019, sort of the average number was somewhere between 35 to 40. And now we're looking closer to about 45, if not more, of these deaths happening per year. There is no central registry that sort of keeps track of all of these incidents, but the Kids and Cars Safety Organization is doing their best. And we know that there's roughly about 45 of these happening per year.
Geez, that is a lot. For parents or caregivers who may be quick to judge or say, I would never forget my child, what would you say to them to help understand how it really could happen to anyone?
Well, I think it relates back to your first question and how do these things continue? Because people think it would never happen to them. And we know from looking at the various families that these tragedies have occurred with that it could be anyone from someone with a GED to multiple college degrees. It could be someone who is very financially well off versus someone who is unfortunately on public assistance. There really is no one family that this happens to. It happens in families where there are multiple children, and it happens in families in which there's only one child. There really is no specific demographics or pattern that creates these situations. So one of the things that I would tell any family would be it could happen to you. Remain vigilant about where your children are, when you're picking them up, when you're dropping them off, and create safety plans that allow for reminders, particularly when you're doing anything that's a little bit out of your normal pattern.
Yeah, and my next question is kind of a follow-up, which you're touching on a little bit already, is what are, some common misconceptions and what are important steps that parents and caregivers can take to prevent leaving a child in a car?
Absolutely. So some of the common misconceptions is, well, it can only happen if they're left in the car for the entire day. Not true. In fact, the temperature inside the car can actually reach up to 115 to 120 degrees within the first 30 minutes that the car is closed. One of the other things is people tend to forget that it can happen even if the temperature outside is only 60 to 70 degrees. It doesn't have to be 97 degrees outside for one of these incidents to occur. So it's not as though you can just forget about being careful or safe when it's the spring or the fall. You should really maintain vigilance at all times. Some things that parents can do that would help to provide reminders are things like visual cues. So if the child is in the back seat, anytime they're in the back seat, maybe putting a stuffed animal or another object that gives you a visual reminder that they're there. For someone who carries a purse or some other bag or item with them at all times, whenever that child is in the back seat, maybe you should put that item close to them because you're not going to leave your car without, those necessary items that's just ingrained in us, like a cell phone. But keeping that near the child may ensure that you look in the back seat. One of the other things is just simply always checking your back seat. Just make it a part of your habit. When you get in your car, you close the door, you put on your seatbelt. Well, when you get out, you open the door, you close one, and then you open the back door just to always double check. Something that we can all do.
Thank you. From a community health perspective, what is it? really take to reduce these incidents long term? Is it education? Is it legislation, technology, all of the above? Like, what do you think makes the most impact long term?
I think the most impact long term is going to be technology. We know that anything that relies on humans ultimately can be flawed. Humans, we are flawed in and of ourselves. And so it's impossible to think that we will never forget. No one will ever, this will never happen if we just educate people more. It's really not about just education. So, creating safeguards within cars that don't allow you to walk away or maybe alarm more frequently if there is a suspected child or another person in the back seat who's locked in, creating, I know with the rear facing child seats, people often can sometimes forget that the child is there. You can actually use your own sort of creativity and put a mirror there facing the child that you can see from your rear view mirror. And that way you can always keep an eye on your child. So I think it's a matter of using this technology and the resources that are out there and also continuing to work with our car manufacturers and insisting that they create more safety layers for families.
Yeah, thank you. And how would you talk to parents and really share information without shaming them, but still stressing the seriousness of the preventable dangers?
Sure, we're all we all do our best. These things aren't happening to parents who don't love their children. These things are just happening to parents who happen to forget the child is in the back seat. We've all been there where we've forgotten our cell phone, forgotten our keys. And I know that we'd all love to believe that we would never forget our child, but unfortunately that happens. So just create that pattern, that vigilance of always looking for them, always knowing exactly where they are. And that actually becomes a pattern and behavior that can be helpful in other aspects of life as well.
Um, and what's one piece of advice that you wish to give to any parent or caregiver when it comes to keeping children safe in cars, anytime, but especially in summer?
Absolutely. One of the things that I would just always stress to families is that it could happen to anyone. And it's not to scare people, it's not to shame them or to make them feel bad. It's just to remind them it really could happen to anyone. The first layer of defense that's lost is believing that it doesn't apply to you. So I would really like to just continue to remind parents, and I do, even if they're in the emergency department for a stub toe or maybe a broken arm, just giving basic safety tips for the summer is always really helpful. And that's something that other pediatricians can also do.
Um, where can families go to get more information or support?
So going to Kids in Cars Safety, that organization is very helpful in one, keeping track of the statistics regarding these sort of fatalities. They also have a number of tips and hints for families, and you can also find additional resources for other things like how to properly install your car seat, what at what age can children really go to the front seat or should they remain in the back seat? They have just a wealth of information for families that can help keep children safe.
Perfect. Thank you so much. Is there anything else that you wanted to end off with or any other comments regarding?
So signs that the child is overheated are things like instead of being playful or active, they start to become lethargic. They're not really talking or moving very much. Their breathing might become irregular or labored. And they might start having vomiting or other things like they just can't walk. They're unsteady on their feet. Things like that. I would call 911 immediately. The paramedics can get to you pretty quickly, and they have wonderful resources for cooling people down who are suffering from a heat related illness. If you believe that you can get the child to an emergency department faster, that's certainly an option, but you want to make sure you're doing everything possible to sort of monitor them in the same at the same time and trying to cool them off, like removing hot clothing and unnecessary layers. Things of that nature would be fantastic. And again, our EMS community is so wonderful and they have so many skills for taking care of heat-related illness. I wouldn't hesitate to call them for my family.
Perfect. Thank you so much. Those are all the questions I had for you today.
Awesome. Thank you.